is that you can't change it because the hospitals are the biggest employers and it will wreck the economies of the community they're in. I don't buy that. I don't think it is good for us to continue to sustain people in positions that add no value to support the economy. I think, truthfully, there are a whole new era of jobs in healthcare. They're associated with being people who are wellness coaches, people who manage patient populations, that those people who are doing things that don't add value in a hospital environment can be redeployed with the basic information that they have in programs that do bring value to health. And it's going to be hard work, but it's doable. The longer we stay with an argument that we must support the system as it is because we, in fragile economic times, can't move away from it, it's impossible. You give yourself no degrees of freedom to fix the problem if you accept that argument. I come from the state of South Carolina. You know, it's tough when the tobacco farmers in the state have to realize that they're producing a product that the country doesn't need. They've got to begin to think about growing something else. Well, the same sort of situation exists, you know, in the way we run our healthcare institutions. We're paying a lot of money to people to do a job which is over-processing, which is a different kind of waste. And unless you create the economic incentives for people to stop doing, as long as you're going to get paid for it, you're going to do it. But when you stop getting paid for it, then you will have to create, you know, the thought processes that lead to something that will be an improvement. And we do it in every other aspect of our economy, but we don't do it in healthcare. So I think it is true that we need to be knowledgeable. So how does a small individual deal with these complex issues of quality? I think you have to select business partners that can help you and that you trust will guide you. And that's why these predetermined programs are useful. I was asked, what would I tell you all? And I wrote down 5 things. I would say that you ought to look at organizations and ask what their philosophy is with reference to sustainability and quality. And are they willing to be your partner in terms of this problem for some period of time? I think we've learned that changing healthcare organizations every year doesn't give any benefit. Ask whether or not they have a organized response to the quality movement. If they look strange or don't know what the triple aim is, quickly leave. Does their method of practice support integration of care? And you should ask that of the hospitals as well as the provider groups that people see. Do they have a focus on prevention and health? Do they offer a patient portal? Can your employees get information about their health from the internet, from them? Specific information like what is my cholesterol and how far am I from my optimal blood pressure and how many refills do I have left on my prescription? Can I send a message to my doctor that someone will answer within 24 hours? And finally, do they work well with the payers? Because if there's a conflict continuously between the provider and the payer, it's not going to be in your best interest. There needs to be a partnership here, and there often isn't, because there are different interests that are being pursued. So those are discerning questions that you can ask as you try to seek to find the best value, and also simultaneously improve the environment that we all work in.